I'm here to support. I'm Alice, the creator of Fertility Answers, and Serena is one of my dearest and mightiest friends and colleagues, an IVF doctor at IRMS in Northern New Jersey. They're in for a lot of ice tomorrow.
Yeah,
we had
to rearrange all our appointments tomorrow,
which is a bummer.
Skating around in the ice.
Yeah, of course. That's terrible. So the thing that we kind of want to bring up though is access to your medical records.
So medical records, I get so worked up about medical records.
I know.
And Dr. Norian could get worked up with us because it's like our healthcare system is broken. And I think we shouldn't have to worry about this, but you as a patient need to take control not only of your life and your body, but also your medical records.
100%. You have to keep it current.
We're supposed to be aiming for with electronic medical records is that, everybody has access. Everybody that's important that you need to have access to your information will have access to your information. Right. And yet we're going to protect your information and keep it private. And the truth is that it's a mess. It's a mess. And it's very important that you take the extra time and the extra effort to have a copy of all your medical records in your own hands.
Absolutely. In your own hands. And I'm going to give a couple examples of why this matters.
Transferring the appropriate information from one doctor to another, because this idea that doctors can use an ancient device called the fax machine.
And that's considered HIPAA compliant.
and somehow your records, all the right records will be transferred to the right doctor is actually a total farce. And I tell my patients, if you're going to have your doctor fax me the records, I can guarantee you I will not get them. Like that's just like taking your records and just like tossing them out into the street and hoping like they get to my office. And what really happens is that you then have 10 people at my office and the other doctor's office, plus you and me calling over and over. Did you get the fax? Did you get the? Yeah, we got the confirmation. You should have the fax. Well, we don't have it.
We'll send it
again.
Exactly.
Like, over and over and over is like a comedy routine.
Right. And you have 118 employees, I learned. Okay. Yes. John at HRC probably has that many, if not more. Right. And so, that's 118 opportunities for them to get lost in transit and multiple different locations and everything else. And so what the reason this came up today, you guys, is because we have a new patient that we're supporting who has had to move a lot for work and for her husband's job. And so she's had lots of different providers, which many of us have had. And she's coming in and not really even remembering what labs she had done. And this is so traumatic for all of us going through infertility. And so your memory when you're going through trauma doesn't even store memories in like a healthy sort of normal way. It gets all jumbled. We don't remember what we had done. We don't remember the labs. And there are companies that have or are trying to solve this through things like MyChart. MyChart is horribly designed, but at least you can connect in different health systems that might have access to some of your records. And that has helped me at least a little bit. It has not all the health systems have connected up to it, so I haven't been able to access everything. But now this poor woman who's already been through many miscarriages plus a stillbirth has to backtrack to her traumatic history and, get access to all these records. And it's going to be a huge pain in the butt, huge.
So as things are happening, as you're in treatment, periodically, maybe every few months, you just say, let me have a copy of my medical records from this month and this month. And then,
it just has to be
out, scan them in, put them in a file. And like I actually have mine, I have a whole pile of printed stuff, but now I have like an online folder and I just throw everything in there. And cause you never know when you're gonna need it.
That's right. So John's actually recommending Dr. Norian at HRC Fertility is a good friend and colleague of ours, everybody on the West Coast in the Southern California area. He says, yes, patients are the best courier for their own records. An old school manila folder with key highlights on a summary page just up front, and you carry it with you always.
Yeah. Like who else to better be a guardian of your information except for you?
Yeah.
It makes a huge difference because, you know, like you have these busy offices and you're calling and they've already faxed it twice and it just hasn't gotten there. It's frustrating for everybody. And, you know, so until we have a better system, I totally agree, Alice. People should have all their own, and you know, I think it's also very educational and helpful for you to look at your own reports. I've had patients that, you know, really gained a lot of insights because they know more about their own body than I do. And they might be looking at something and see it in a different way than I do. And that can often be really helpful. We really feel, I don't think we used to feel this way. Traditional medicine wasn't like this, but I feel that the patient voice is a huge part of the treatment plan. It can really be a really positive factor. So
I think that that's unique to you and to some of the other people that have been referred into our network at Fertility Answers, because unfortunately that's not the case kind of across the board. Right. We hear negative stories too. That's the exact opposite of what you just described, which is, no, you're not supposed to have an opinion because I'm the doctor and I know everything and you don't get to speak up.
And that is just
a travesty.
Of course, the doctors have a tremendous amount of knowledge and training, but I really think, you know, healthcare requires a whole team, and that includes the patient.
You're the CEO of your own team.
Yes,
exactly.
Absolutely. Yeah.
All right. So that's our rant for the top of the hour. Now we're going to get into some patient questions. If you need help kind of even accessing this, we have heard stories of doctors saying, no, I'm not going to release these records to you. That's not okay. And it's illegal.
That's not okay. No, so you own your records. So you
own them.
Right to them. Yes.
Yes, exactly. So we're going to get into a couple questions right off the bat here. So Kimian is scheduled for her first transfer on February 18th. This is very exciting. Fingers crossed. She's asking about some patients taking aspirin as part of their protocol. She asked her doctor and he said it was up to her if she wanted to take it.
So I feel like if there's not a very specific indication for the aspirin, I don't recommend using it. A lot of people are just taking aspirin because they feel like it just does all these great things. And there's a lot of talk on the internet, try taking aspirin. But aspirin, I think, should be used for specific things like you have a persistently thin lining despite all the normal hormonal treatments and everything is normal about your lining except it's thin. There are studies showing that baby aspirin, even if it doesn't thicken your lining, can improve the implantation rate in people who have persistently thin linings. If you have a history of like preeclampsia or pregnancy-induced hypertension, then your OB probably should start you on baby aspirin when you're about 12 weeks pregnant. If you have a history of antiphospholipid syndrome, a lot of hematologists and high-risk OBs will start you on baby aspirin. Some people start you before you're pregnant, some people start after. Like I feel like, or you have some other, often, you know, the most common thing is like some sort of hematologic condition that predisposes you to clotting. A lot of people will be put on baby aspirin to prophylax against harmful clotting. So I think it's important that, first of all, that you don't take baby aspirin unless your doctor's okay with it. I know for my patients that are doing egg retrievals, the people that are on baby aspirin definitely bleed a lot more.
Sure.
So even though it seems like a nothing dose, it definitely has a physiologic effect on your body and your clotting system. So I don't feel like people should take baby aspirin without a specific indication. Now, having said that, people are doing studies on baby aspirin, like baby aspirin in recurrent unexplained pregnancy loss. There may be some data there. So I definitely think you should discuss the pros and the cons with your doctor and make a decision that way. I tend to be conservative, so I don't tend to give it unless there's a specific indication.
I love that answer. I'm actually going to transcribe that answer and turn it into a blog post. So we have sort of, here are the top 5 reasons that people typically would use baby aspirin.
Okay,
And
cool.
yeah, hopefully that will help just curb the kind of rampant, hey, try baby aspirin that shows up on, Facebook groups and things like that.
We have so many myths that are out there. And I think because they get repeated so often, like you say it enough, people think it's true. Like the whole myth about you'll have a higher chance of pregnancy if you have intercourse right when the egg is released, which is like a big, and everybody thinks that. So,
right.
But it's not really true, so.
Right, exactly.
That's up there.
Luciana is asking a great question. I think we're going to have to keep talking about this for the next 6 months, really. Her COVID vaccine is scheduled for 3 weeks after her transfer. We haven't talked about timing during pregnancy. Does that matter at all? Because if you have like an immune response.
We don't know.
Okay.
We do not know. So right now, Dr. Fauci says 20,000 pregnant people have been vaccinated.
Amazing. That's double than what it was a month and a half ago.
Yeah. Isn't that amazing?
Amazing.
And they're probably mostly healthcare workers, right?
Right.
They're all in the United States. They're probably mostly healthcare workers. And I bet there's less that have done it in the first trimester rather than the second and third trimester, because I think there's a natural tendency to be a little more conservative in your first trimester. Although I'm sure that some of them are in their first trimester. And so far, knock on wood, just as we thought from what we understand about the animal data and what we know about messenger RNA vaccines, so far they're not seeing any serious issues. So that's good. But obviously we have to, like all these people that are pregnant now, we're going to keep tracking them. We're going to see what happens when they deliver, all of those kinds of things. So we don't know about timing. I do know that just in general, I am seeing a lot of my patients feel a little more comfortable about avoiding the first trimester, but we really don't think first trimester is an issue. We're not really anticipating that there's an issue. So I think but everybody's situation is different. Like what if you have a history of a lot of miscarriages? If you don't do anything in first trimester, you miscarry, it might have nothing to do with each other, but you're going to second guess yourself.
Agreed. Yeah.
And that's not a good position to be in, to feel really uncomfortable about that. So you have to be able to get to a point of where you make a decision, even though we don't know everything. You can get to a position where you feel like, I feel comfortable, I made an informed decision, and I don't have any regrets. That's what we're aiming for now. But the CDC and the ACIP, the Advisory Committee for Immunization Practices, and SMFM, Society for Maternal Fetal Medicine, ASRM, American Society for Reproductive Medicine, and ACOG, the American College of OBGYN. So all the American authorities and experts and Dr. Fauci all feel that if you're pregnant, no matter where you are in pregnancy, if you want the mRNA vaccine and you have access to it, you should be able to get it. Whether you do it or not, ultimately is your choice. But we don't want other people to hold you back from it if you feel comfortable taking it. And a lot of people, at least 20,000 pregnant women already have done this in the United States.
And they're still pregnant. So that's like the most important thing.
But so far, everything looks good. Yeah. So, so those are the things to think about.
I think you and I talk about that a lot. Like, what can you live with if the outcome isn't what you intended, right?
Right. I mean, because bad things can happen at any time.
At any point. Yeah.
Nothing to do with anything, but you want to feel good. For yourself, that you did the right thing for yourself.
And it's not even so much like COVID vaccine or not COVID vaccine. It really is like, well, what are you comfortable doing in first trimester at all, right? Because you're already in the infertility community. This has already been a difficult journey. And I think that first trimester is such a sensitive time for those of us who had to work so hard.
Really a tough time,
I mean, I remember like, I was the laziest version of myself in first trimester ever because I was
a lot of people
scared.
like put themselves like a little China doll on a shelf.
Like a little that's exactly what was me. I treated myself like a China doll for certain. I did.
It's hard not to do that when you've been through, when you really suffered.
Exactly. That's the thing. I think that so many of us are in that same boat. So that was another useful answer.
If that's what people decide, we totally understand and support that. That's completely reasonable. But to say to a pregnant woman, you don't deserve this life-saving vaccine.
Right, exactly. That's not okay.
High risk.
Right.
That's what we do not want to say that.
Right.
We do not want to
I do know one person in our community who is no longer reproductive age, but she did, from her second dose, she did get 101 fever. And so, although it's more rare, we have heard some people getting those fevers. And so during first trimester, we would be worried about that as well.
It's very interesting though, Alice. I am still worried about fever, but ASRM on their guidelines actually said they're not so worried about fever. Hi.
Okay.
Hi, Dante.
Dante says hi, everybody.
Which I thought was very interesting. They're like, if you're taking folic acid, you're taking care of yourself, and hydrating. Don't worry too much about fever. Take a little Tylenol and don't worry about it.
I did read that good news too, that you can actually take a fever reducer and it's not a problem in about 30 minutes, babe.
Having said that, I don't think people should be sitting in a hot tub or,
No, we don't want, we don't do that. Although, we're having a very snowy day in Northern Idaho here. And so
it does sound nice. So you can put your toes
in a hot toddy. Exactly. Kimmy Ann is just following up on the baby aspirin question. She does have hypertension, but it's controlled on labetalol. Labetalol.
Labetalol is a beta blocker, alpha agonist, very commonly used, very effective antihypertensive treatment that is generally thought to be safe during pregnancy.
Right. So that's great. So really, if that's already being controlled.
But it's super important to keep monitoring your blood pressure.
Right.
And keep getting exercise and sleep, both of which affect your blood pressure. And have a healthy diet, because blood pressure and pregnancy are really a bad combo. So it's much safer to have it controlled than to avoid medication. This is another situation where sometimes people are like, well, you're pregnant, you can't take medicine, which is crazy. Because with hypertension, with high blood pressure, it's so much safer to take the medicine in pregnancy than not to.
Exactly. And there's, that's the same with antidepressants and anti-anxieties, is that there's classifications of those drugs for risk on pregnancy. And so in some cases, you might want to try switching a few months before you get pregnant so that you can get like your levels right and you like it and you have the same impact. But similarly, like the risk of not being on anything is so much more harmful than being on the medication.
Yeah, some people, it depends, because there are some people with depression and anxiety who will respond to therapy and non-medical intervention, but there are some forms that really medicine is really the best treatment.
Right.
And if you need that to be able to function at your best, you probably are going to do better on medicine during pregnancy than not. But it's definitely, you should talk with your psychiatrist and hopefully a therapist too.
Yes.
And your OBGYN, like everybody needs to kind of be on the same page.
That's right.
Yeah.
Melina's asking, years later, still not knowing why she's infertile. We see this all the time. She doesn't have regular periods. She's had 2 miscarriages. We see this just so much, Melina, where people have been kind of struggling and suffering on their own without having gone in for an infertility workup. So if she was ready to take the step to get into an IVF clinic, Serena, what would the workup look like?
So you have to see why you have infertility and why you had the miscarriages. And often there's a tremendous amount of overlap in both, but the testing is slightly different. So kind of like a Venn diagram, and you want to get the testing for both, like karyotypes. Are your chromosomes normal, or is there a balanced translocation? testing for antiphospholipid syndrome, testing your thyroid, testing your general health, because optimizing general health is really important as well. Making sure that the inside of the uterus looks good, making sure that there are no infections, or diabetes is a really common cause for miscarriages and infertility. So you're kind of looking not just at the GYN thing, but your whole general health. And I think if it's been many years and you have both infertility and miscarriages, you really should see a specialist, a reproductive endocrinologist.
So that was something that came up too with one of our new patients that found us today, where you could just tell by what was done at the OBGYN level. I was advocating for, yes, it's time to move on to IVF, because there's just so many more diagnostic tools at your disposal that you guys have access to.
Well, seeing an IVF doctor doesn't necessarily mean you have to do IVF. So typically when we talk about IVF doctors, we're saying somebody who does board certified in OBGYN, but then subspecialty board certified in reproductive endocrinology and infertility. And of course, IVF is part of that. But, that you're right, that evaluation that's done by a reproductive endocrinologist is much more thorough. And, and the option of IVF is always there, but it doesn't mean you have to do.
Exactly. And we always love to remind people that we will not place you with someone who's going to quote unquote sell you IVF. Because I think that's the big reason why people don't want to step foot, because inside a clinic, they think, well, I can't afford their treatment solution. But the reality is you have lots of treatment solutions at your disposal.
Right. And sometimes just getting getting more information, if not like a diagnosis, can be really helpful. We do often come up without a precise diagnosis, but we often can come up with some really good interventions to try to improve your fertility.
Yes, exactly. And most of those interventions are things that improve your overall health and wellness for the whole rest of your life. Yes. So even if you do achieve success without further assistance, we should say, our intent is that we help you be a healthier mama, and therefore it leads to a healthier baby. Yeah. Annette's asking a really curious question. I have not seen this before. Do IVF babies have a higher likelihood to be born with a congenital heart defect?
Not that I'm aware of. So in general, the general quoted rate, because there's no global registry. Okay. And every country is a little bit different. Like Belgium is super good about following up all their IVF babies. United States is kind of a patchwork, although we do have the CDC reporting. So in general, we say like the normal birth defect rate for naturally conceived babies is around 5%. Some are mild, some are more severe. For IVF, it's maybe about 8%. So there seems to be like a 3% excess risk. Now, of that 3% excess risk, maybe 99% of that 3% excess risk is parental risk, because IVF parents are high risk parents. They are older, their BMIs are higher, they have a lot more medical diseases, they're taking a lot more medications, they have a lot of infertility, a lot more miscarriages, and things like endometriosis, PCOS, ovarian failure, sperm issues, all those things. So the rate of those issues that confer a higher risk of potential birth defects exist in IVF parents. So then there is like a tiny little bit of what we call dish risk, because like something that comes from the process of IVF itself, we do think there's some, but in general, for most people that are doing IVF who really need it in order to conceive, that little tiny excess risk is worth the huge benefit of, without IVF, you might not get pregnant anyway. And a lot of that excess risk actually is the 2% identical twinning rate. So identical twinning, instead of 0.5% that occurs in naturally conceived pregnancies, identical twinning happens 2% of the time in IVF pregnancies. Whether you do ICSI or not, whether you do hatching or not, whether you do PGT or not, it just seems higher.
Sure.
So that's a dish risk. And identical twins are definitely a much higher risk pregnancy. They would be regardless of where they come from.
Exactly.
Right.
Well, that's why we got so upset when Paris Hilton was promoting use IVF to have a boy and girl twin. You get to pick. You know, we were so upset at that promotional nature of going for twins because of the high risk to mama and the babies.
Yeah.
You know, and it's just not the kind of message that we want any of our community members to hear. You know, all of us kind of go through this being really grateful to have one healthy baby, right? And you know, hearing her kind of speak about it in the way that she spoke about it was very dismissive of the risks to both her health and to her future offspring's health. And it's just simply not what we want people going into IVF trying to do on purpose.
Yeah.
So that I have a sidebar question for you, Serena. Have you always been so good at statistics? Because you can rattle off these numbers like you're looking at a cheat sheet. And I'm wondering if your memory always was like that, or it's just after having practiced for so long.
There's certain questions that I feel like I'm not actually so much of a numbers person, but there are some things that I think that's a big one that hopefully is reassuring to patients about how safe IVF really is.
Yeah, absolutely. It reassures me.
Babies are totally healthy. So
right. I mean, that's the thing, you know, if you only like me if your only option is the frozen embryos, it's the IVF process. It's very reassuring. Yeah. But you are hysterical with stats and facts. I just want to walk around you with like a tape recorder and just make all these infographics from what you say. Okay. Christine, I'm just checking in with you. Did you hear the response about the COVID vaccine and timing your FET? If you didn't, we can reiterate it because people hop on and hop off all the time during this hour. So just let us know if you need to hear that again, and it's no problem. Mirel Russo is asking about thoughts on cod liver oil during frozen embryo transfer and after confirmed pregnancy.
So I don't know that much about cod liver oil. My understanding is like it may be a good source of omega-3s, and that's why people take it. So you do want to have a good source of omega-3s. Probably the best way to get omega-3s is if you're an omnivore, then to have 8 to 12 ounces of fresh seafood a week. If you're a vegan, to use a lot of flax seeds, flaxseed oil, hemp hearts, chia seeds, things like that, to make sure you're getting plenty of omegas. But if you're an omnivore, it's actually good to get both seafood omegas and plant omegas if you can do both. And and you could also just cheat and do flaxseed oil capsules and fish oil capsules, which just makes it a little bit easier. But I don't know that much about cod liver oil. I would definitely want to make sure it's mercury free.
Right, that's important. The source of it is so important.
Yeah.
Right. Dante and I take gummies. They do have a little sugar coating, but they taste so much better sometimes than like
and then
a giant capsule.
I like throwing hemp hearts and chia seeds and
all
that into like everything, like oatmeal and
love
yogurt.
it. Yeah, exactly. Felicia's asking kind of about the baths or the hot tub thing. I mean, she and her husband have been trying for a year, so they start their fertility testing next week. So that's a big, bold step, Felicia. And we know that whatever got you to this step was not easy, but you're on the right path to get the workup done. So that's kind of the first big thing. And then as you find out data and get information about yourself, you can always hop on the Fertility Answers app, ask follow-up questions, ask questions about what you're learning, so you get multiple opinions about the path that you want to go on. She is asking, is there any connection between hot baths and infertility for both men and women? Or is it really just hot tub level?
If you're chronically taking hot baths and raising your core body temperature, theoretically, it could have a negative impact upon both your eggs and especially the sperm. The whole reason that testicles hang in the scrotum is to keep the temperature lower than your core body temperature. So if you're taking those testicles and dipping them into hot water, that's not good for them.
Right. The Track Fertility brand, they have an at-home sperm testing product that's phasing out, but I loved their brand, and they published this thing, don't cook your balls.
Don't cook your balls.
Yes. And it was just this like hilarious approach to that fact though, and like really breaking it down for people about sperm health. I think it's this Wednesday, I'm interviewing Dr. Spitz again, who's our kind of resident urologist. He wrote the penis book. He's fantastic. He's been practicing urology for 21 years. So that would be Felicia. If you have any concerns about male factor, come on Wednesday's show. I believe it's at 3 p.m. or 4 p.m. But you can check our schedules on there.
Hot showers, but the bath is like,
right.
That can raise your core body temperature.
All right. Lots of good questions are coming in. Beautiful brown eyes read on American Heart Association website that using high doses of folic acid has caused hypertension in pregnant women. And she says that she's noticed her blood pressure elevates when she takes prenatals.
That's interesting. I think you need folic acid.
You have to take the folic acid
in order to lower your risk for neural tube defects.
But I wonder if it's activated folic acid too. I wonder if it's folate versus folic acid.
But clearly, you definitely want to have a home blood pressure monitor, keep a log. I think that's good that you're noticing that it's associated with certain things. But you probably should be seeing like a cardiologist or somebody about your hypertension and to get a full evaluation and see what's going on. Because even though you feel like it may be triggered by the prenatals, you still have to get some folic acid. You probably still need the nutrients in there.
And there's ways to manage high blood pressure.
Regardless of what it's triggered by, we still have to address the high blood pressure.
Exactly. Okay. Steph is asking a great question about low sperm volume in IVF. Can it still be successful if there's low sperm volume? It's a great question.
Absolutely. But maybe make your guy drink more water too.
Okay. So it could be a hydration
But
issue.
Low sperm volume can be treated. He should have an evaluation with the urologist. Some people actually have like obstruction and things like that. So definitely have an evaluation, but low sperm volume, yes, very easily treated with IVF.
Yes. I mean, it takes literally one twitching sperm to be alive for them to just inject directly into an egg. So low sperm volume is probably one of the most easy things for you to deal with in IVF,
exactly.
right?
Yeah.
Yeah. Luciana's asking a follow-up question. Are IVF pregnancies higher risk for preeclampsia?
For preeclampsia. So first pregnancies over 40, donor egg. So there's definitely overweight. There's a lot of risk factors that overlap with infertility, IVF patients, and preeclampsia. So I would say, but IVF itself directly increasing the risk for preeclampsia, I'm not so sure about that.
Right. Okay. Muriel's nurse at the clinic told her to stop taking omega supplements and vitamin C once she starts her FET. Is there a data-driven reason for that?
I'm not totally sure why, but I would definitely ask them about that.
Yeah, ask why.
Like some people, there are a lot of surgeons do feel like people who are on omegas tend to bleed more. So I know, I know the plastic surgeons, they're just like, they don't want any blood around. So they always say, like they'll say, stop all your supplements before an invasive procedure, but an FET is not invasive. So I'm not totally sure why.
And that might be overly cautious, and it might just be leading up to the FET. And you could probably go back on right after. So maybe ask about for how long, in advance, why they're really saying that, if they could point to the data sources as well. So we could kind of fact check for you. That would be helpful too.
Yeah, no, we'd like to hear back from you.
Yeah. So if somebody does have hypertension when they're trying to conceive and when they get pregnant, should they be under the care of a cardiologist and the IVF doctor and also an MFM, or just the cardiologist and kind of their regular care
team?
Out
it depends on the region and the hospital you're going to deliver at, and your doctors, like how they like to manage it. I know at my hospital, the maternal fetal medicine people usually don't want to see you until you're pregnant. So I usually make sure the cardiologist is happy, that they've done a full workup, because you need to know why. Do you have like some weird cause for the high blood pressure? Maybe they can cure that, because, you know, most people that are going through IVF are relatively young. And so we need to figure out, you have to make sure you don't have renal artery stenosis or like something crazy like a pheochromocytoma.
Okay.
And then you have to be treated for the high blood pressure, and they have to make sure your heart is okay, because high blood pressure can damage your heart and that can affect your ability to carry a pregnancy. So those things need to be evaluated before you get pregnant. So usually I do cardiologist plus your primary care plus me, and then MFM once you're pregnant.
Okay. I like it. Does flax affect estrogen levels?
Does what?
Flaxseed affect estrogen levels?
Not really. Don't eat pounds of it though.
Right.
Okay. And then it should be ground. It has to be ground and roasted.
No, otherwise it just comes out in your stool and you don't digest it.
Right. Yeah.
Yeah. It's gross. All right. Felicia though wants to know about hot baths for her. She wants hot baths.
A what?
Hot baths for Felicia. It's not just about her man. She loves her hot baths. So is there a different level of risk, but she should just forego them while they're trying to conceive? Yeah.
Yeah. You can't put your vagina in there.
Yeah.
You could soak your feet maybe.
Yeah, maybe there's something else like with aromatherapy and like a foot bath. That would be good. Maybe she gets herself one of those like, plug and bubbleable ones that you just, sit and are amazing. Mandy's asking, what about cold showers? The opposite. Do you take cold showers, Mandy? I did that for 3 summers in college when I was selling books door to door. I can't stand them now.
Cold showers. I don't think that should be harmful, although that sounds very unpleasant.
It does sound unpleasant. Okay, Bancy's asking laparoscopy for endo. Does the surgery itself affect fertility? We get this question a lot.
There's a big study done about endo, and it can improve your fertility a tiny bit, but not nearly as much as IVF. And so because surgery is invasive, usually if somebody is not in terrible pain or we're not worried about cancer or anything like that, we usually try to avoid surgery and just get you pregnant, because pregnancy also helps to really suppress endometriosis. And surgery, you're never going to get rid of endometriosis with surgery because it's a systemic disease, and you could potentially, you have risks of bleeding, infection, damage to organs, anesthesia risks, and potentially scar tissue with the surgery. So you really want to make sure there's a good reason for the surgery. It's not usually to improve your pregnancy rate.
Right. I think it's Alkiki is asking, is there something over the counter like antioxidants or something that can help with sperm mobility?
So there's a little bit of data showing that, some antioxidants can be helpful. I think usually I'll tell my male patients, take a look at the theralogics.com site, and they have some nice vitamin formulations for motility support, but it's you definitely should have a primary care evaluation. You should have a full semen analysis, 2 or 3 full semen analyses at a fertility center, and you should see a urologist who specializes in infertility to see what else is going on. Certainly there's no downside to antioxidants. It's probably not the full answer though.
Sure. And we do have a partner that is coming out with a CBD epigenetic test. So for CBD users, the point of the test is to evaluate how you can continue to use CBD therapeutically while counteracting the negative impact on reproductive health. And so this is up and coming research that does show that there's a downside of CBD and reproductive outcomes. Turning on bad genes, turning off good ones. And so it's a really interesting field because as we've, been promoting kind of the use of CBD, and there's so many different forms now that people can take it, this is something that hasn't really been talked about that much, except for, you know, you and I advocating for like, just stop everything, right? But if you're struggling, just stop everything. But this is kind of a cool opportunity, you know, when Avrio Genetics releases this product, because I think people are going to learn so much about themselves and their own genetics and how their lifestyle choices are impacting the expression of their genes.
The personal genetics thing is so fascinating. I did want to say, like, just to Chen Lab, about the fertility diet. My favorite fertility diet is Dr. Chavarro, Chavarro, and Dr. Willits at Harvard. They wrote a book called The Fertility Diet. It's basically like just a healthy diet, like a lot more plants, you know, but that's a great book. It's easy to read. And I'm doing an Instagram live tomorrow.
You are, it's going to be so fun. You're going to make something.
Live cooking demo with Jeannie Pedrucci at Living Plate. So, you know, hopefully you guys can join with that too.
Oh my gosh. What time is that at?
That's at 4:30 p.m. Eastern Standard Time.
Okay, so that's going to be super fun. I can't wait to catch that because you're like cooking live. I love it. Okay, Sydney's asking, how long do you take vitamins for while pregnant?
You should take it. We want you to start the prenatal vitamins for at least 2 weeks before you get pregnant. But I think, you know, way before you get pregnant is really good. Like we definitely have data showing starting before you get pregnant and then continue through the end of breastfeeding. So I feel like if you're going to have more than one kid, maybe just keep going until you know they're all of them are out.
Yeah. Would males who have reoccurring kidney stones affect sperm count and fertility?
You know, that definitely the kidneys are impacted, and you know, if there's blood in the urine, it can get in the sperm, and that can create a lot of inflammation there.
Right. So, it's also connected.
Yeah, it's all connected. So that you know, they should be treated for the kidney stones.
Okay. So Christine is saying, yes, please repeat the answer and how long about spacing COVID vaccine. So yeah,
that's a very individualized question. So Alice, did you get the information like our COVID vaccine handout?
No, I haven't gotten it yet. Yeah, give that to us and we'll publish it. Yeah.
Okay. So there's a link from on our website. We can just share that. And
IRMS.com.
But it's a whole decision-making process about timing. Some people feel more comfortable trying to wait to get the vaccine and then do their transfer. Some people are, you know, are frontline workers and really nervous about the COVID-19.
Yes.
Getting COVID-19. And so are just going ahead and just not worrying about the timing. Both options are reasonable. I think you should talk with your doctor. We really think that if you feel like you want the mRNA vaccine, that you should have access to it regardless of where you are in your fertility journey, whether you're pregnant or you're trying or whatever. But
some people, that if you delay it, you know, that could cost you sort of your egg retrieval, right? Some people really shouldn't delay IVF at all and can safely
people really shouldn't delay IVF. And honestly, maybe you shouldn't delay the vaccine either. You know, one thing I worry about is we know that we feel really comfortable about messenger RNA vaccines and trying to conceive and pregnancy and lactation, and the new vaccines that are going to come out that probably will be more widely available, like the J&J vaccine, because it's only one shot.
Yeah,
we feel a little more nervous about because it is a live virus. Now, it's a little bit different than measles and chickenpox vaccine, which are live disease-causing viruses. So the chickenpox vaccine actually has chickenpox virus in it. It's a weakened chickenpox virus. Whereas the J&J and the AstraZeneca vaccines are a weakened adenovirus, which theoretically doesn't cause disease.
Right.
So we might be okay with that because that's kind of similar to the Ebola vaccine, which supposedly seems okay in pregnancy. But, you know, there's so much that we don't know. So I kind of feel like you have the chance to get the messenger RNA vaccine, maybe you should just grab it
Right. That's kind of, I feel that
worry
way
about
too.
the other stuff later.
Yeah, exactly. Sydney, can you come back tomorrow at 4 p.m. Pacific time and ask that question with Dr. Sherry? So she's an OB/GYN. Dr. Chen treats people up to like 9 weeks of pregnancy, and then she graduates them. So any pregnancy related questions, come on the Tuesday, every other Tuesday with Dr. Sherry, and tomorrow is her afternoon. She's a celebrity OB/GYN. We love having her on. Steph is asking about weight and pregnancy, or weight and just asking, is being overweight, can that cause issues to get pregnant during IVF?
It definitely can. We definitely think that excess weight is associated not only with things like diabetes and heart disease and high blood pressure. It creates a kind of a state of inflammation and is hormonally active. So there can be multiple mechanisms of action where excess weight can impact your fertility. Now, having said that, I don't really tell my patients, oh, come back once you've lost weight.
Right.
We try to just attack everything at once. I try to give them help and support for losing weight, whether that just be advice or getting them a food coach, or, or sending them to a medical endocrinologist or something like that. But we also try to work on treatment at the same time. So I do want you to maybe not worry so much about the weight, the actual number itself, but try to get healthier, optimize your health, diet, exercise, sleep, see the doctor, the whole package.
Yes. We also, as a company, and as a support, under the Fertility Answers brand and the MedAnswers brand, we've been writing, our geneticist, Dr. Brad Wilson, has been writing a lot about the inherent racism with BMI itself. And so there's a lot of clinics that have kind of a hard and fast BMI cutoff, but it's not a one size fits all with BMI. I mean, it was the system for use with BMI was created with European adult men.
Yeah.
So the things that it doesn't take into consideration is muscle mass, bone density. So these are the types of things that when you have a very personalized, attentive physician like Serena, she's going to cut through all that noise and look at the whole person, because it's not, like you said, about the number.
Rough guide. It should not be treated as like a very precise number, because Alice is right. A BMI of 25 on one person may be really overweight, but in another person, maybe not necessarily so.
Exactly. And the majority of people that are reproductive age have a BMI over 30. So, that the majority, I mean, 60%, of people. So, but it's a really incredibly helpful question to even ask, right? Because our mission is to help 100 million healthy babies be born to healthy mamas, or healthy parents. I always put the S in parentheses in case you're a single parent by choice. And, and sometimes it just starts with using this very motivating time in our life when we are so desperately wanting to have that baby in our arms, to use that as the time to hey, I'm going to take inventory of my own health and wellness. I'm going to create that is.
To infertility. So it's obviously a huge tragedy and enormous stress, but it can also really be a chance to really empower yourself.
Exactly.
And create like a better world for yourself and for your child. And the good news is that being forced to pause and address your health ultimately, I think, is a great thing, because we know the treatments do work so well.
Right.
So I think if everybody could pause a little bit before they conceive and just say, can I be a little bit healthier? I think that would be good for everybody, whether they have infertility or not.
Absolutely. And we are seeing epigenetic changes in babies being born to obese mothers. We see high risk of asthma. We see high risk of then childhood obesity and all kinds of different, adverse chronic health issues. And so that our passion is just helping people get there. And we know that it can be incredibly hard. we know that the infertility path alone is hard. And then if you have to take on, weight loss or healthy eating, or sort of transforming the way that you eat or the way that you exercise, we know that it's all hard, but we have a huge supportive team to just wrap around you. And that's for kind of anybody, no matter where they're at. Some people have to gain weight before they do an FET, right? So, I mean, it's not always about overweight. It's also underweight too.
Everybody here really needs to, pat yourself on the back for being here, for showing up and being interested enough and becoming informed. You're empowering yourself. And I'm like, yes,
I know, it's amazing. Totally, it's amazing. One last thought on the egg health question and sort of diet and these things is that one of the things that I loved when Dr. Green came on the show, from Conceptions in Colorado, is it was the first time that anybody had said it takes an egg 120 to 160 days to mature.
Yeah, and that I thought was very interesting, because she's looking at the journey once they leave the germ cell phase. And
right.
Yeah, very interesting.
So cool, because we talk so much about men being so lucky that they get a 3.5.
Yeah,
that they get a sperm washout, almost every quarter. And I had never really connected those dots. And I feel like sometimes for women, it's like, it feels like the goal feels so far away, but it's so exciting to know, hey, I can commit to change 4 to 5 months at a time, right? Yeah. I can handle that. I can do that. I can be committed. I can make my trackers. I can get on the
down into more bite-sized pieces.
Completely.
Yeah. I think that's a great idea.
And totally celebrating those wins along the way, And
if you fall off,
just a day.
Dust yourself off and get back on.
Exactly. Yeah. All right. Oh my gosh, Lauren, she's 13 weeks with her. Oh my gosh, Lauren. Oh my gosh. I'm so glad you shared that. I'm choked up. This is incredible. 13 weeks. Oh my goodness. Yay. This is why we do what we do, everybody. Yeah. We celebrate every win. We grieve with you over losses.
Good vibes and juju.
Yes. Thanks, Serena. Great show, everybody. We'll see you tomorrow with Dr. Sherry at 4 p.m. Pacific, celebrity OBGYN. So you can bring all the pregnancy related questions.
Dr. Sherry. You guys are going to love her. She's amazing.
She's amazing. Yeah. And any outstanding questions we didn't get to, just head over to the Fertility Answers app and ask them. I'll see you 4 times this week, everybody. So check our schedule. Thank you. Thanks, Serena. Have a great night.